Hi everyone. So we were discussing about preeclampsia, and today we will be continuing our discussion, and we will be mainly talking about complication of the preeclampsia. The complications are more likely to occur if the patient are left untreated. The complication can be either immediate or remote. And immediate, we have the maternal and fetal complication. In immediate complication, we have maternal. We have their complication can occur during pregnancy, during labor, as well as during puerperium. In all of these three cases, and during pregnancy, the eclampsia occurs in 2% of the eclampsia occur more in acute than in subacute cases. There can be a placental abruption or abruptio placenta, oliguria or anuria can be there. The retinal detachment and diminution vision, even blindness, ophthalmic symptoms. The preterm labor, there can be preterm labor, there can be HELP syndrome, cerebral hemorrhage, acute respiratory distress syndrome, and the disseminated intravascular coagulation. And during labor, there can be eclampsia, the postpartum hemorrhage, and it may be related with coagulation failure. And in puerperium, there can be eclampsia usually occur within 48 hours. There can be renal failure, acute kidney injury, and the shock. The puerperal vasomotor collapse is associated with reduced concentration of sodium and chloride due to sudden fall in corticosteroid level, and the sepsis due to increased incidence and induction, operative interference, and the low viability. The fetal complication are the fetal risk is related to the severity of preeclampsia, duration of pregnancy, and severity of the hypertension. Following complication might occur. One is intrauterine growth restriction due to chronic placental insufficiency. The prematurity, either due to preterm onset of labor or due to preterm delivery, and the intrauterine death due to hypoxia, placental abruption, and there can be fetal birth asphyxia. And there might be need for an ICU admission after the fetus is born. The various risk factors for preeclampsia are, according to NICE 2019 guideline. The one is primary gravida, young or elderly, first time exposure to chorionic villi, family history of hypertension, preeclampsia, gestational diabetes mellitus or diabetes mellitus. The placental abnormalities like hyperplacentosis, excessive exposure to chorionic villi, molar pregnancy, multiple pregnancy, diabetes, the placental ischemia, interpregnancy interval more than or equal to 7 years, obesity, there is a BMI more than 35 kg per meter square, insulin resistance, history of PCOS, and pre-existing vascular disease, new paternity, pregnancy following assisted reproductive technology, IVF, thrombophilia and Apla syndrome, protein CS deficiency, factor 5 Leiden mutation. And and these are other risk factors for preeclampsia. Thank you. That was all in this video, and in next video we will be talking about investigation and management of preeclampsia.